Cystoclysis or bladder irrigation. Cystoclysis or bladder irrigation may be defined as the process of flushing the bladder with normal saline continuously to prevent or treat clot formation, allowing urine to flow freely and maintain indwelling catheter patency. Here, a special catheter is used. It may also be used to instill medications such as antibiotics for treating bladder infections, and is done over a period of time and runs continuously. For the purpose of this procedure, it is to prevent clot formation, to allow free flow of urine and maintain IDC patency by continuously irrigating the bladder with normal saline. To drain the bladder when acute urinary retention is present. To relieve bladder spasm and to free blockage in the urinary catheter or tubing. For the indications, first is for acute urinary retention. A patient with acute urinary retention is unable to urinate because nerve dysfunction, constipation, infection, or medication such as anticholinergics and antidepressants causing a bladder spasm. We can use this procedure in order to drain urine out of the bladder, therefore relieving bladder spasm. Next is for urinary tract infection. We can instill medication into the catheter, such as antibiotics, in order to drain it into the urinary tract, therefore curing urinary tract infection. Next is for prostatic hematuria. Presence of blood in the urine, cystoclysis can help prevent formation of clots. Post-surgically after prostatectomy, who have had surgery of the urinary tract. Patients who undergo surgery in the urinary tract are at risk for formation of clots. The procedure can help by preventing formation of clots that may cause blockage to the bladder. For the contraindications, first is the hypersensitivity to the solution to be used, and patients with defects in the bladder, mucosa, or bladder wall. It can cause further injury to the bladder wall. Types of irrigation cystoclysis. First is closed bladder irrigation system. It does not require that the system be opened. For frequent intermittent irrigations or continuous irrigation without disrupting the sterile alignment of the catheter and drainage system through use of a three-way catheter. It can be used to instill medication, encourage hemostasis, flush clots and debris out of the bladder and catheter. Second is open irrigation system. The bladder is drained using a 60 ml syringe. Opening of the closed drainage system to instill bladder irrigations, and is used when bladder irrigations are required less frequently and there are no blood clots or large mucus fragments. For the goals of this procedure, the urinary catheter remains patent and urine is able to drain freely via the indwelling catheter or IDC. Second is the patient's comfort is maintained. Clot formation within the bladder or IDC is prevented or minimized. And lastly is for the patient, risk of urinary tract infection is minimized through use of aseptic technique when connecting bladder irrigation to IDC. So next is the steps of the procedure. First is to explain procedure to the patient and ensure patient privacy. Second is to position the patient for easy access to the catheter whilst maintaining patient comfort. Third is to ensure that the patient has a three-way urinary catheter. If not, a three-way catheter needs to be inserted. Next is hang irrigation flask on IV pole and prime irrigation set, maintaining asepsis of irrigation set. Note, only one of the irrigation flask clamps should be open when priming the irrigation set, otherwise the fluid can run from one flask to another. After priming the irrigation set, ensure that all clamps on the irrigation set are closed. So next step is don goggles an impervious gown placed underneath catheter connection. Next is to attend hand wash and don non-sterile gloves. Next is to swab indwelling catheter irrigation and catheter ports with chlorhexidine swabs and allow drying. Remove the spigot from the irrigation lumen of the catheter using sterile gauze and discard spigot. Connect the irrigation set to the irrigation lumen of the catheter, maintaining clean procedure. Next is to connect the irrigation set to the irrigation lumen of the catheter, maintaining a clean procedure. Remove spigot or old drainage bag from the catheter lumen using sterile gauze and apply catheter drainage bag, maintaining clean procedure. Note, do not commence bladder irrigation until urine is draining freely. And lastly is to unclamp the irrigation flask that was used to prime the irrigation set and set the rate of administration by adjusting the roller clamp. Note, the aim of the bladder irrigation is to keep the urine rose-colored and free from clots. Next, we move on to the nursing responsibilities. So before the procedure or examination, first is to check physician's order for type of irrigation and irrigation solution to use, date, time, room, and name of the client. Next is to explain the procedure to the client. A third is to gather the necessary materials. Next is to do medical hand washing. Next is to open the IV tubing and then do priming. Next is to assess lower abdomen for bladder distension. Lastly is to position the patient dorsal, recumbent, or supine. Next, during the procedure or examination, drape the patient, exposing the leg where the catheter is being taped. Next is to do gloving. Next is to cleanse the catheter injection port with antiseptic swab. Next is to regulate the flow rate and its ordered rate. And lastly is to measure urine output every hour. So after the procedure, the nurse will perform aftercare and do proper documentation, amount of solution used as irrigant, amount returned as drainage, and the characteristics of output and calculations. So next is the guidelines involved in irrigating cystoclysis. First is to determine whether the irrigation will be open or closed. There are two types of irrigating cystoclysis: the open and closed irrigation system. Also, a physician's order is required to perform this operation. The order should include the type of solution to be used, the rate of the irrigation, and whether the irrigation should be continuous or intermittent. Next is to set up sterile irrigating supplies, maintaining sterile technique per agency protocol. It is important to maintain the sterility of equipments, insertion and maintenance of three-way Foley catheter patency involves a closed drainage system and sterile technique. Sterility and patency of CBI system is maintained to avoid infection and occlusions. Next is to use only clearly labeled or prepared solutions for irrigation. In irrigating cystoclysis, irrigant solutions are used like sterile normal saline solution, so it is important to use only clear labeled or prepared solutions to ensure that the right solutions are used and to prevent committing errors. Also, most of Foley catheter insertion are done with antibiotic solutions, so a doctor's order is needed. So next is flush tubing prior to irrigation, to clear air from the tubing that might cause bladder distension and to know the patency of tubing. Next is to check for bladder distension. It detects whether a catheter is malfunctioning or blocking urinary drainage. Next is to cleanse the site of entry or end of Y connector with antiseptic or disinfectant. It is to prevent infection. Next is to the saline solution for infusion should be stored and infused at a room temperature. Normal saline solutions could be irritating to the delicate tissues inside the urethra and bladder, especially if there is already some trauma due to the insertion and presence of the catheter, so whatever solution is used should be warm to the body temperature, because cold solution can cause spasms that are very uncomfortable to the patient. Next is strict input and output is recommended for all patients receiving CBI. Special attention to frail elderly and or history of pelvic floor or bladder radiation. These patients are at high risk for bladder perforation. Next is, if an obstruction occurs in the catheter, the irrigation should be shut off and manual irrigation should be performed to remove obstruction. When manual irrigant flow freely, the irrigation can be resumed. And lastly is to determine an accurate output during bladder irrigation. Subtract the amount of irrigant used from the amount of drainage obtained. The difference is the patient's output of urine and blood.